In terms of challenges for COVID-19, in our practice, we've tried telemedicine. However, it's not been very successful for us. One of the reasons I believe is that we are a visual field. I mean, in most cases, we really don't need a history. We just need to look at the eye. The problem is it's not so easy to look in the back of the eye, even remotely through an iPhone camera. There are technologies that we're working with that we can adapt the phone, for example, by putting an ophthalmoscope, which is a machine on the back of a phone for screening, but still someone has to be there and someone has to actually look at the patient. And that defeats the concept of telemedicine or remote medicine. I'm actually working with a company that may allow patients to do their own retina selfies, but it's still a work in progress and in the early stages. Now, telemedicine may work for the front of the eye, and if you can see if a patient has an infected eye or it's conjunctivitis, but for diseases like glaucoma, macular degeneration, or diabetic retinopathy, one needs to examine the back of the eye. This requires dilation or a really good imaging system. So that's a real problem since patients have to come to the office or have to come somewhere to capture the image. And when it comes to therapy, patients need shots, and that can't be done remotely. Now, there are a couple of technologies that are on the horizon that are very exciting. There's something called 4C Home, which is available. It's a home detecting system for macular degeneration. With patients monitoring themselves at home, the patient is able to detect change in a patient's test and notify the doctor's office. It's currently used screening for patients with dry macular degeneration to detect conversion to wet macular degeneration. And then for patients undergoing injections, it's a little more complicated. We currently use an OCT machine to determine the response to therapy and to see if more treatment is needed. Well, there's now a clinical trial being done looking at a home OCT machine that people use at home. The patient looks at the machine daily, and if the machine notices a change in the swelling, it can notify the doctor's office. This can be done using artificial intelligence. The hope is through AI, the machine can determine microscopic change on OCT and give patients treatments only when they need it, thereby decreasing patient burden and increasing compliance. I think that's where the future is going, not only just for COVID, but to monitor people in different parts of the world, especially where healthcare is really limited. I believe this technology is going to have great potential.